All right. I don't know if y'all hear that, but it talks in my ears because I'm on my headphones, so it kind of me out for a little bit. All right. Which one are y'all looking at? Can y'all tell me?
Medical terminology slides.
All right. So you see the big slide, or you see like a little
See one
bit
slide
screen and all
in the
that?
corner with a bunch of little slides across the bottom.
Yeah. Hang on. That's not what I want. So see, I figured that was gonna happen to me, and this is what. That's why I try to log in early and get it situated. So hang on 2 seconds. Let me fix this. All right, let me bring this back up. Sorry, I'm still learning this, y'all. All right, hang on. I'm gonna stop the slide for just a second so I can get it situated. I don't know why it's doing that. So anyway, how's everybody going? How's your test going? Any trouble, any issues with anything right now? I'm trying to figure this out.
No.
All right. I am going to try to go over some stuff in a minute that I need to touch base with everybody. So I'm gonna share something again. Give me just a minute. It'll fix it. All right, so y'all see the one big screen now?
Yes.
Yes.
Okay, good deal, good deal, good deal. All right, I don't know, it's technological errors on my part. No, just to catch up with everybody, and I am recording. Okay, cool deal. So did everybody, and I sent out a blanket email, and y'all will notice I will do this majority of the time, just because make sure it's covered. Did everybody get the message on Discord from Rob about the financial statement, the financial issues for anyone? If it doesn't apply to you, don't worry about it, it's fine. And did anybody get my email stating the same thing? I don't expect everybody to
Yes, I got
come
it.
up with all the, okay. And it's like I said, y'all, if it doesn't apply to you, then ignore, that's fine. But we just want to make sure that everybody has got the same information, and that if you are happen to using this, that's perfect. But let's just make sure we get Rob the information that because come the 15th, I don't want to be that bad guy. I don't want to have to do that to anybody, and neither does Rob, because we want to do what's best for every single student and keep everybody's ability in their mind the best for guys. Let me answer one quick question on Discord. I'm having to get back in the swing of things because remember I just drove home today. It was a long drive, but I'm trying to get situated here at the residence now. All right. So let's get started. So tonight, to be honest, y'all, I don't know how long tonight is. I'm not one of those instructors that is going to keep you forever and ever and ever just because it states that we must be here for 4 hours. I'm gonna provide you the information. I'll provide you probably some useless information that you guys are gonna, what do you tell us that for? But I'm not gonna eat your time up just because it says. I'm gonna make sure we get all the information, answer your questions, and we're all gonna have a good time. Hopefully we all learn something as we go from here. All right, so medical terminology. Here's our wonderful National EMS Education Standards competencies that we have to go over every time. Medical terminology uses foundation anatomical and medical terms and abbreviations in writing or communications with colleagues and other healthcare professionals. Now I know that when we write, if some of you guys write for, in school and you write your own, you may write in shorthand and yourself, but when you get into the medical side, you can't really just use your own medical terminology. You have to use what's out there. There's several books, there's several different things that cover all of the medical terminologies that's accepted across the boards, from MD to PA to nurse to medic to healthcare. I mean, any part of the healthcare, it's all covered in these books. At some point in time, I will hope that every single body, sorry, Aaron, yes, I just saw your message. We did skip chapter 4. We'll hit that later on. Samantha, can you hear me? I'm seeing everybody's. So we good, Samantha? I don't know if anybody has times with her, but she says she can't hear me. So when we go through this, at some point in time, I will start going over on how to get everybody to understand on how to write medical reports. I'll show you a medical report. We'll go over it in detail, but that's going to be later, kind of closer to the time you start just doing before you do any of your ambulance clinicals. We're going to go over all that. So the lecture outline tonight, we're going to do, as an EMT, you must have a strong working knowledge of medical terminologies. You need to know what certain symbols are, the abbreviations, the proven words, for with, at, is, CC's, chief complaint. You can't just write big C, because that could be carbon copy. There's certain abbreviations that are approved. So we want you to be familiar
Chris,
with those.
I can't hear. Can you hear me?
Oh yeah, I hear you, baby. You loud and clear. Anybody else hear me? We good? Everybody hear me? Somebody tell me down there at the bottom. Okay.
I'm good.
All right. Sweet. Sounds good. All right. So when you go and you start learning different definitions and parts of medical terms, there's, the prefix, the suffix, they mean certain things. Like hyper means high, and then hyperglycemia. Glycemia has to do with diabetics. And you have hypo means low. So there's certain more times you're going to have to break down parts of the word to understand what they're talking about. Now, at the same time, as we don't want to be the group that goes out there and we don't want to be the ones that go out there and just start talking over a patient's head just because we know we learned some new words and we can use them. Well, just because we learn something new don't mean that we know. So let's just talk. If we have to talk common English and basic English to somebody just so it makes them feel better, so what? I mean, just be like, I'm like, oh, you got any? Are you a diabetic? You hyper or hypo? They're gonna look at you like, what? You got high or low sugar? They get you. They pick up what you're putting down, and that makes them feel comfortable. So don't just talk over to them. Let's just make it, easier for the patient. So on medical terminologies, let's say you know where they come from. They're old. Some of the new words have been out there. Medical terms are made of distinct parts of the preform specific functions. Changing or deleting any of those parts can significantly change the function or meaning of words. So be very careful when you're writing your reports and you go out there and you start making this documentation change and you're like, hey, I know these big words. Well, do you really know them or do you not? Because there's sometimes I'll be writing a report and I'm like, oh, the easiest words in the world confuse me, like diarrhea. I cannot spell it. to save my life right the very first time. I always write it wrong. And brain, I always spell Brian, and I have to go back and fix it every single time. But a lot of the antibiotics, I have no issues writing. I just carry on with it. It's just a trigger in your brain. So make sure you know the right prefix, suffix when you starting to make these words and terminologies out. So the components that comprise medical terms, we talked about this. So you have the word root. So the root is the foundation of the word. We want to make sure that the foundation is known. What do we know? How do we know this? Is this good? Is it clear? Is it precise? And let's move on from there. So the prefix, what occurs before the word root? So so the word root is like glycemia. Okay, so that's the root. Then you have hyper or hypo. So that is the prefix. Now, if you're talking about, suffix, we know these from, basic schools. And so suffix is what occurs after the word. So when you combine those vowels, that join one or more words, roots, and to other components of a term, that's when you start, multitasking is what I'm gonna call it in EMS. And we have to be on our toes. You need to know, is it the front side of the body? There's certain type of words, like, oh, it's on their back. Well, yes, you're correct, but let's write the proper terminology so it doesn't make us look like a goober. Yeah, picking up. How the parts of a term are combined determines its meaning. So here's the big part. I have the world's worst trouble on sometimes pronunciating words, and y'all will figure that out as we go through this class, because I'm gonna be like, never mind. Y'all just read that one, because I ain't gonna mess with it. I don't know. And that's just me. I would rather do it that way. But when it comes down to writing reports, you need to be very clear spelling. If your spelling is not there, Google it. You got a computer in your hands. Let's use that. Let's make that work. So accurate spelling is essential in medical terminology. So the suffix phase means speaking, whereas phagia means eating or swallowing. So let's, pronunciation and proper spelling is really going to be ideal to the patients. The prefix dis means difficult or pain. Dyspnea means difficulty in breathing. Dysphagia means difficulty speaking, while dysphagia means eating or swallowing. So they're very similar, but at the same time, they're spelled just a little different. And that's where we're going to make sure that our spelling is utmost to the point. Accurate spelling is essential in medical terminology because we need to make sure we know what you're talking about. I'm trying to Google where the I can pass on some words to y'all. Let me I'm gonna type this in the chat and then I will tell y'all. Oh, here it is right here. All right, so ncems.org, it's all the approved medical abbreviations. This is when you open it up, you will have like BP means blood pressure, BM means bowel movement. It gives you all the ones that we need to write as we're using this. So that's going to be beneficial to y'all. The further we go throughout this of a correct approved medical terms as we're getting these reports. And this is on an individual scale. Would just be a requirement of the class. It's not like it's one of those that it is mandatory. Going throughout this process, I want you guys to learn and be the best that we all can be. That's the easiest part, is I want to make sure y'all look good when you leave here. Let's see here. Root words. The main part of a stem word is called a word root or root word, and it conveys the essential meaning of the word. Frequently indicates a body part. EMS, obviously, we deal with a lot of body parts, tissues, organs, and all that. We want to make sure we're talking about the correct one. We're trying to explain it. If you're talking about a limb can be either for 2 arms and 2 legs, but your proper terminology, if you put a tourniquet on his right lower leg, but in your writing your report, you quoted it as your upper right arm, well, that's pretty important to make sure you fix out which ones are which. So right here, when it's talking about adding or change a prefix or suffix to a meaning of a term, be careful on that. So adding prefix or suffix to the word creates a term. Changing the prefix or suffix will change the meaning of the term. Some word roots may also be used as prefixes or suffixes in other terms. So you see on your screen, it says cardio is the word root for heart. Pulmo is the word root for lungs. So you get where you have the pulmonologist, same thing. Click next. Why don't it work? Okay. So prefixes. A prefix is a part of the term that appears at the beginning. Man, I feel like we're repeating ourselves. I don't know about y'all. I feel like it's over and over and over. Prefixes usually describe location, intensity. A prefix gives the word root its specific meaning. By learning the commonly used medical prefixes, you can figure out the meaning of the terms that may not be familiar to you. So there's another page. Let me find that because I looked at it yesterday before I left. See, if I would have been at work, I'd have been ready. I'd have had all this for you. Let's see. All right, so I am a huge advocate of, y'all know the books that are like out there, it's called For Dummies. So when I was going through paramedic school, they actually had a book for cardiology for dummies. Well, I wore that book out. And it was amazing. It helped me through things. All right, so I typed in there www.dummies.com for medical prefixes. Make sure you just Google that for you there, so that'll be part of it. So man, class, baby. So knowing these prefixes and the words, and the abbreviations helps us all three as we go through there. But the Dummies series is phenomenal. No pun intended to anybody, no trying to be ugly to y'all, but they're great. So I highly suggest, and just you can YouTube it, not YouTube it, but you can Google it. A lot of those, or you can pick up what you need for free off out there. Suffixes are placed at the end. Same thing in school. They preached this. They said, and when you get out of school, you can always use this. Well, yeah, I know they were right. Suffixes usually indicate a procedure, condition, disease, or part of speech. Combining vowels. Whew, I feel like I'm like English 101 here. A combining vowel is the part of a term that connects a word root to a suffix or other word root. Geez, in most cases it is an O. However, it may also be a I or an E. When joining a suffix that begins with a consonant or when joining another word root, the combining vowel helps ease the pronunciation of the term. A combining form is a combining vowel show with the word root. Bruh, I hope y'all picking up on this. Yeah, I think we're gonna start spinning the wheel of fortune, like my wife said. We're gonna figure out some A-E-I-O and U's, and we'll go from here. Okay, so word building rules. The following summarizes the rules covering thus far. Now, you wrong about that. I will not make a great English teacher because I can't even speak Mississippian, so y'all can find something else. Well, yes, my spelling is a little off, but that's why I Google it. All right, so the prefix is always at the beginning. However, not all terms will have a prefix. The suffix is always at the end of the term. Use a combining vowel, then a suffix begins with a consonant to make a pronunciation easier. A term has more than one word root A combining vowel must be placed between the two word roots, even if the second root begins in a vowel. I have no idea what that said. I'm just telling you that we gonna hit this. Look, we just changed slides. It makes it a little bit easier. Y'all, I'm sorry. I don't even know. We're going over plurals now. To change the term from singular to plural, certain rules apply. Sometimes you can simply add an S, like lung becomes lungs, but some rules are more complicated because of the part. Rules you may encounter when converting from singular to plural terms. Singular words that end in a change to AE when plural. I don't know what this is going to do to help us. I am so sorry. So on your screen, it shows you from vertebrae to vertebra, and then diagnosis to diagnosis, apex to apexes. So you can kind of see how they having to change them because of the pronunciation and the correct proper English. Wale does not have that, I can tell you. Special word parts, prefixes can be used to indicate numbers, colors, positions, or directions. This is breaking it down right here. So on numbers, several prefixes are used to indicate if a term involves a number such as half, one, or two. So these are kind of important when you're talking about una, because you have multa and prima. So you'll talk about pregnancies right here, prima, multa, unilateral, bilateral. Those are kind of important. You'll talk about those too. Lee says, "Oh my goodness, I'm gonna have to watch this over and get." I'm telling you, it's rough, y'all. I don't know. I didn't know I was agreeing to teach English. I thought this was EMT school. So yeah, the struggle is real up in this class because this is, even though I'm teaching y'all, I'm learning something because I promise you I'm gonna have to go back to the slide to use it. Several root words are used to describe a color. So you talk about cyano, we can talk about cyanosis on breathing. Leucio, and we're talking about leukocytes in different parts of the body. Kobe, I'm kind of agreeing. Can we skip this chapter? How about y'all just get 2 chances at the grades and we'll see if we skip this chapter later. So we're going more off the Greek and the when we started about certain abbreviations. So that's where some of these meanings and terms go deeper and deeper into. We'll talk about here on the prefixes can describe position, direction, or location. So over here on the far right, we'll have superior, epi, trans, para, add, and d, and curriculum. So different parts, different positions. You'll see those are prefixes of words. Directional terms, where an injury is located and how the pain radiates. See, now I can talk to y'all about this. I can handle this part. Whew, I hope we gets easier from this point. All right, so common direction, movement, and position terms and directional terms. So you'll have your right, left, superior, inferior. So lateral, medial, proximal, distal, superficial, and deep. I mean, so y'all can kind of figure that out. So we know our right and left. I hope to God you know your right and left, because if not, please let's talk about this offline. Lateral, medial. So these guys, I'm actually gonna tell y'all, it's gonna be very good for y'all. If you don't know them, take a little picture, write these down, because this is very beneficial that you look these up and go ahead and get a upper step on things. And if you've looked through your book, I know there's some the little blue skill parts that will help you learn some of this a little bit easier on the way that they are breaking the terminology down. It'd be very beneficial to you the further we go throughout this class. So we talk about directional terms. You have ventral and dorsal, palmar and plantar, and apex. This is kind of the building blocks that we're going to go through these over the next few chapters. I say few, several months. So it's going to be broken down so you know where these root words come from. You know what when we start talking about unilateral, that you understand that you may be able to hear a word and you break it down. Oh, I remember, I can break it down. I know what body part, I know if it's a color or if it's left, right, up, or down. So those will help you. That's the reason why they break it in here. Maybe we should have skipped this chapter instead of chapter 4. Probably we'll work on that next time. Okay, so superior is near to the head, inferior is the feet. So terms to describe relationships of one structure to another. The knee is superior to the foot and inferior to the pelvis. Somebody tell me what that is. You can type it, talk it, doesn't matter. I'm giving y'all a chance because I need to take a drink. Kobe, how's it going? Just give us the attendance code. Okay, so I'm gonna break this down to you. So the knee is further from the foot, but it's inferior to the pelvis, so it means it's nearer, so it's closer. So the knee is closer to the head than the foot, and then but it's further from the pelvis, closest to the pelvis. See, I'm confusing myself now. Whew. Maybe I should, oh, Jesus. All right, lateral medial. So this is talking about outer. If you're lateral to the medium part of the body, means you're talking about maybe to an extremity, left, right arm. And then if it's medial, it's closer to the midline. And midline just means if you'll draw a line down the center of your face, all the way straight down to your body until it stops. That's the midline. And if that's some things when we start talking about neuro, we'll talk about, do they decorticus or, decrepitous, certain parts, if they flex towards their cord, means they're having certain type of, neurological issue. I can teach you more on that. So when it goes into medial, you want to know, and then lateral is the outside. So these words are breaking down so we can pick them up. Proximal and distal. So the proximal is closer to the trunk. So when let's say your body goes into shock, it will shunt the blood from the legs to the proximal trunk, stomach, and the core of the body. It keeps things going. Distal means further from the trunk, near to the free end of the extremity. So you have your I just went for blank of what the bones and the fingers are called. They're not in space real quick. So, but anyway, so it's distal is like your fingertips. That's going to be the distal to the hand. If that makes any sense at all. Phalanges. Thank you, Rebecca. I appreciate it. That is correct. So you have your distal phalanges. You may have your toes. It's talk about your fingertips. That's part of the thing is the distal part of your finger. All right, superficial and deep. Superficial means like if you just it's a paper cut. Okay, deep is obviously like a stab wound. Pretty sure y'all picked up on that one. I didn't have to worry about breaking that one down. Justin, guys, things forgive me. Well, I promise you, it's a struggle for me too. It is struggling. It's real. So we're gonna work on this. I'm gonna probably send y'all a bunch of information to catch up on to help you out on this. Because I don't think I'm doing the best of world in explaining this one to y'all for medical terminologies. So ventral and dorsal refers to the belly side of the body and anterior surface of the body. So dorsal, so we talk about your dorsal pulse, just remember this, is going to be, refers to the spine side of the body and posterior surface of the body. So posterior, does anybody remember what posterior means? Think about, read this right here. So the posterior surface of the body is the dorsal fin of the dolphin. Okay, so that's the top. That's their feet that they're flapping in the wind, all right? So you have your dorsal or your pedal pulse is down as the furthest you can go. I bought the workbook that goes along with the text. It's pretty good for review and study. Thank you, Justin. Sweet. Hang all that out. The more common used terms in anterior, the front surface of the body, and posterior, the back side. So you'll talk that a lot is posterior, anterior. So when you put somebody in a supine position, you want to check the posterior before you move on. Run your hands down the posterior, the back. Just it's another term because they want us to make sure we speak at a higher level so we understand we can pass things on. Palmar and plantar. Palmar is the front region of the hand is referred to as the palm or palmar surface. The bottom of the foot is referred to as the plantar. So that's where you get plantar fasciitis. That is really, really painful. It sucks. I don't know if y'all knew that, but I'm just letting y'all know it sucks really bad. Apex is plural aspects of the tip of a structure. To make any sense. So the apex of the heart is the bottom inferior portion of the ventricles. Let that sink in for a second. So you know what these words mean now. You having a better idea of what they're meaning. You can pick up what they're trying to say. So the top of the heart is the bottom of the ventricles, right? Because you said apex is the tip of a structure. But you know, you got to think about that. Let that sink in. So movement terms, you have flexion, extension, abduction, and abduction, adduction. So adduction and abduction. So bending of a joint, straightening of a joint, flexion, extension, adduction is motion toward the midline. So if you take your hand and you stick it far out, you make your arm straight out from your side, and then you bend your elbow and you're trying to touch the center part of your chest. That is adduction. So you're going to move towards the midline of the chest. But if you move your arms away, that's abduction. So they want to check your flex. You make sure you have good joints. You're not missing anything. If there's a bone or joint that's out of place, that's what they're doing, is checking your adduction or abduction. Functional terms, a body part that appears on both sides of the midline is bilateral. Structures inside the body also appear on both sides of the midline. What is one structure that is bilateral that's on the inside of the body that everybody can think of? Think about that. Somebody tell me. Hips, go higher. Kidneys, oh, yep, ribs and lungs. That's where I would go with. The kidneys is a good one. So those are both bilateral. So you need to know, like if you're listening to the right lobe or the left lobe, and you always go off the patient side. So if I'm facing you and I listen to your heart, I'm listening to the patient's left. Yes, it's confusing for some. I get that. I get it. I get it. Anatomic positions, you need to know where they are supposed to be. Okay, are they anatomically where they're supposed to be? Like if you have like your throat, you look straight up and you grab your esophagus. That is midline. That's in its anatomic position. Well, if you accidentally have a pressure change and you have a midline shift of your vocal cords and your esophagus, that's not good, bro. I'm just gonna tell you, you hurt me. So there are many terms used to describe the position of the patient once you arrive and during transporting them. You need to make sure you document that correctly. The body is prone position when lying face down. The body is in the supine position when it's lying face up. You always transport your patient in the supine position. Now, if you put them in the prone position, you better have a dang good reason why they're supposed to be transported that way, because that'll get you in big trouble. So then you can go to the Fowler position. That is in the semi-reclining with the head elevated. So if you transport somebody, you always want a position of comfort. You never want to sit them at a 90-degree angle. You always want to sit them at a 45 or between the 90 and a 45. Sometimes people that can't breathe want to sit straight up. Perfect. But in a normal resting position, you want to transport somebody in a 45-degree angle. All right. So is this the semi-Fowler's is a semi-reclining position. So it's the patient's head is elevated. It helps them breathe a little bit better. A patient is sitting upright instead to be in the Fowler's position. So Fowler's going to be in a 90. You do a semi-Fowler position, you can do 45, a little bit lower, and they're going to be transporting comfort all the way to the hospital. Oh, look, I just broke it down. Look at there. High semi-Fowlers, 45-degree angles, high Fowler, 90 degrees. It just depends. Sometimes your patient feels like they're drowning if they're if they have fluid on the lungs so much, if they know that they have CHF and as their pass, they can't lay down, they can't sit back. Those are the ones that you're going to find that sleep in the semi-Fowler's position, because they sleep, everything they need in the world is next to their favorite recliner because they can't lay down no more. You'll see these homes, if you haven't before, that you'll see, well, looks like Fred hadn't moved in 17 years. That's just normal for them. That's how they function. Let's see, breaking terms. So you can use knowledge of the meaning of the parts of this to decipher the meaning of the term. When trying to define a term, begin with the suffix and work backwards. If the term also contains a prefix, define the suffix, then the prefix, and then the word root. So here are some examples. Thank God. All right, neuropathy. So we want to go neuropathy. Pathy means disease. Those they're combining the words. Nepher means kidney. Neuropathy equals disease of the kidney. So look, I done learned y'all something. Bet y'all won't forget that one. I had somebody tell me one class before, neuropathy is pain in the feet. I was like, no, I think we can argue about it, and I'm cool for a good argument. But you wrong, bruh. So all right. Dysphoria means condition of. Dys is difficult, painful, or abnormal. Uria means urine. Dysuria means painful. Hypermesis. Hyper means excessive. Emesis means hyperemesis. Emesis means vomiting, and hyperemesis means excessive vomiting. That's me. Anytime I get sick, I get hyperemesis. I don't vomit normal. In case y'all want to know. Analgesic. And Jesus angles is to pertaining to, and is without or absent of. ARES word root. Can anybody hear me? I don't know what happened there.
Yeah, but you're still in and out, breaking up real bad.
Okay. Well, let's see here. Let's take a quick break and let me figure out what's going on here. So give me just a few minutes, okay? We'll take about 10 minutes.
I have a question whenever you get a minute.
Can you see what can y'all see first, and then I'm gonna answer your question.
I can see the full slide. It looks like it's in
Okay.
the full screen mode.
All right, good deal. Yes, ma'am. Go ahead with your question.
So, can you go back to the dysuria slide?
Okay, I can. I don't know what is my problem here with this internet.
There you go. So, with dysuria, I mean, of course, the prefix means difficult, painful, or abnormal. But see, the definition of the word is painful urination. So do y'all use that as interchangeable? So it could either be painful urination or difficult urination or abnormal urination. So, I mean, since they're all kind of, it's not right. So
Right.
so basically it's just some difficult, painful, or abnormal urination. So it's kind of interchangeable. So if
So,
somebody, you see what I'm saying?
right. So I'll tell you what Chris Wiley does, and I've written a lot of reports here lately. I am a plain English guy because of when law enforcement got away from 10 codes, everybody went to plain text, plain English, and simple English. So I quit writing all the big master words to make me look like I'm super duper important because I'm really not. I'm just an average guy. So if they have painful urination, I just write it. It's not that I don't know the word, but why can't you just put, painful urination, or, there's a proper terminology for sickle cell. Why can't I just write a patient suffers from sickle cell? So, but the main part of what I want y'all to know is the abbreviations. The words to me are not near as important, but you need to know how to dissect the words. So when you go and pick somebody up from the, let's say from the hospital, well, that's just as important knowing what you're picking them up for, because when you look at their chart, you need to know what's going on. So if you see all these massive words, you need to know how to break them down. But overall, the abbreviations that you write in your report, like when I put in there the one, I had to move locations in my house, I'm having to reevaluate. So when I talked about the the abbreviations from ncs.org, that's what I want you to look at. Because as we start writing these reports, I just want y'all to be familiar in what the correct, because I'm kind of particular about how you write your reports, because I've been to local civil court, I've been to state court, and I've been to court. So I have some education on that. And the attorneys will make you look like crap just because you lose the wrong abbreviation, not the terminology of a word. Even if you write painful urination, why didn't you use dysuria? Why can't you just read what I wrote? So that's why I really want y'all to know those abbreviations better than anything else.
Okay. Just
Did
because,
I answer any part of your question?
yes, I just come from I actually have my degree in veterinary technology, and so a lot of the words are the same. And so I just wanted to make sure that,
The medicine's the same too.
do what now?
A lot of the medicine's the same too.
Yes. And so I just wanted to make sure that, on the human side, that it's pretty much the same concept, the same thing, versus veterinary medicine side. So,
Yes, there's not going to be any, if the animal can get a UTI just like an adult can. So
right.
if you abbreviate UTI, that is a standard abbreviation for urinary tract infection. That's okay. And I'm sure if you've read some of your doctor's reports at the veterinary clinic, it's going to be some of the same abbreviations because it's a medical abbreviation. So you're on the track. You have some really right questions, but just going to get you in the same exact way.
Okay. Thank you.
Yes, ma'am. Thank you for asking. All right. I don't remember what slide I was on. Okay, there we are.
Yeah,
I don't know. Is everybody? I can see. Okay. I think that's where we were. Is that where we were, y'all?
yes.
Okay. So on the shorthand, why is it not going? Come on, Kaswali. All right. So shorthand, you can use shorthand, but make sure you know what you're talking about. If you use a shorthand, you need to rewrite it before you transfer that information to somebody. Because if you give them to them and you get shorthand, that nurse or the doctor's gonna be like, "What the hell are you talking about? I can't even read this." I do that if I'm in a trauma situation. I do a lot of like I have my own because I know what it means. So I read a lot on gloves and sticky paper stuck or the tape stuck to my leg. I have different ways I like to do things because I know it. I know when I sit there and give a report to somebody, I can do it. But the big thing right there where it says don't trade speed for accuracy. Let's see, developed because abbreviation shorthands was developed because one can communicate faster using this method. Use only common understood abbreviations to minimize misinterpretations and errors. Here's the big, the Joint Commissions and its Institute for Safe Medical Practices are considered two authorities on abbreviations and provide do not use lists. So there's certain ones that they want you to use, but at the certain times there's one they don't want you to use because it's too close to another term, or they can sway you from meaning something else. That's like with and without has two different, not like the W with the line. That's not what we use. We use a total different one. Without is an S with a line over it. It's a little S with a line over it. And with is a C with a line over it. So it's just some of the things that we've used over time. I'm sure y'all see me scrolling around my mouse. I was trying to find something. But make sure you use the correct one, and it doesn't make you look bad when you come back and you use the wrong one. So the abbreviations are used in place of words. They shorten your notes and documentations. When you use an acronym, you are shortening several words and usually using the first letter of each word to make a shorter term, and that's pronounced on its own. Be familiar with accepted use of abbreviations in your local jurisdiction or service area. I don't know where a lot of you guys are from. I'll speak some of your bigger ambulance services, Acadian Ambulance, AMR. I know Memphis Fire. Majority of your EMS agencies that are accredited are all using the same abbreviations. You can pick up one from the other because some providers work in different states, so they just accepted the medical abbreviations as common use of practice. So it's not like you're going to have to learn different ones from different services. It's all recognized, and they kind of cross lines with each other. Symbols sometimes used as a shortcut. Make sure you know the right ones. The tables in the chapter provide a thorough reference list of common words, root words. So if you look on your books, your ebooks, that has that information in there. It's to cover those. Here we go. Let's use this. So if everybody can answer this as we go through the chapter, or y'all can put it down at the bottom. Which of the following components of a medical term conveys its essential meaning? Medical words can be very special. Yes, that's correct, Ryan. All right, so I see most people are choosing C. That's right. The root word conveys the essential meaning of a medical term. The prefix usually describes a location or intensity. The suffix will indicate a procedure, condition, disease, or part of speech. Combining vowels are used to connect a word or suffix. All right, let's go to the next one. Prefixes can indicate what? Somebody tell me. I got 24 people in this class. Come on, y'all doing right? Just keep typing. I see it. That's some people not paying attention.
D.
All right, I see a couple of differences between A and B. So let's look at it here. The answer is A. Prefixes are used to indicate color, numbers, positions, or directions. I know I probably confused a lot of y'all about this, and I am 100% sorry. Suffixes will indicate a procedure, condition, disease, or part of speech. Word roots will indicate specific body parts. I hope that helped a little bit. I'm kind of doing this as the review because I know that I do the best on this chapter, as y'all can tell. The plural form of the word bronchius is what?
D.
You say Bravo or Delta?
Delta.
All right, let's check it out. There's a lot of D's in there. It says Delta. When a word ends in us, the plural form end in I. For words that end in A, the plural form will end in AE. When words end in is, plural form will end in ES. Holy moly. Woo. All right, let's see. The statement, the lungs are superior to the bladder, indicates that the lungs are closer to the
C.
good deal, good deal, good deal. Maybe I didn't badger this too bad. Maybe y'all are picking up or y'all are way smarter than me and y'all already knew all this. I hope it's the latter part. All right, the term superior is used to indicate a structure is closer to the head than another structure. Inferior is a term used to describe a structure that is closer to the feet. Superficial means it's closer to the skin than another. Proximal is used to describe a structure that's closer to the trunk in comparison of another. All right, last one of these. Movement of the arm towards the midline is referred to as what?
C.
What's
C.
everybody think? What's everybody think? All right.
C.
See, senor. I don't speak Spanish, so I can't even help y'all out there. All right, there's the answer, C. The term abduction is used to describe a movement of the structure towards the midline of the body. See, maybe I gave y'all a really good explanation of that, and that's the reason why y'all remember that one. So guys, that's literally that's it for the tonight. That was 51 minutes, and that's with a few minute break because something happened at my house and I lost service. I apologize because I know that I feel that I did not teach that part of this class the best at all. I will post some better information. I will send it to Discord, or I will try to add it to Navigate. Hey, I want to show y'all something real quick. I'm gonna pause this. I'm gonna open up my screen for. Let's see here. Does anybody have any questions real quick? I see there's a chat, but I can't open it just yet. So y'all give me just a second. Y'all just quiet. Y'all just wanna. All right. Somebody tell me what y'all are looking at real quick. Y'all looking at my JB Learning?
Yes.
Looking at your launch button.
Yeah, I see the webpage.
Okay. All right. So this is going on the instructor side. I know some of y'all have seen why it has Krista on here. I can't answer that. I don't know. I can't tell you that. But I want y'all to, does your screen look similar to this?
Yeah.
Yes.
Yeah. Yeah.
Okay. Have y'all ever really looked on this side over here?
I
On
don't
the
know.
far right hand side?
I have that stuff.
Okay. So I'm gonna show y'all something one time, and then y'all need to be on top of this from now on. Oh, look, y'all see that right there? Just see my circle?
Yes, I see it.
All right. I'm gonna click on this. This will randomly pop up throughout this course. So in this assessment, there will be several topics that will open at different dates that will require you to write on a pre-chosen topic. I understand that some topics may not be discussed during the chapters. We want you to spend a little bit of time doing some reading and write about your thoughts and ideas. So starting on the 14th, our topic is body armor for EMS providers. Is this a good idea or bad idea? And how do EMS companies afford this? And how do they provide these for each employee? This will close on the 18th of July. You participate and you provide a good, decent written review, you will get extra points. We are in the process of talking about how many points, but I will definitely update this in here on how many points that you can get. I'm not by any means telling y'all that anybody needs extra points. Y'all's grades look freaking awesome. Y'all are doing really, really good. But just know that this may show up at a later time and it may not. So I just didn't know if that emailed you guys that this was in here, because I couldn't figure out how to send it to y'all as an assignment. So so the hot topics will be open from the 14th to the 17th at 11 o'clock at night. I know that there also has been some issues with the test date. So let's prime example. So this one, guys, this one will be opened until July 13th at 9 p.m. Oh, sorry, this one it opens. And it will be open for 3 days, like I told y'all before. So the 16th at midnight. Y'all picking up? Y'all with together and all that?
Yes, I have a question.
So the hot talk to me.
Okay, so my question is, like for the hot topic, now, do we need to, like, how long do you want it to be? And, like, do we need to like cite sources and all that? Like put it in
No,
like research format? Okay.
You just heard me try to teach y'all a topic on grammar and graphic, and I couldn't barely talk. I feel like I've shorted y'all something there. So You don't have to cite no pages, nothing like that. This is, I mean, y'all see, this is what I see, but mine's, I can't see from the student side. I want to say, I'm probably showing y'all some more than y'all really care about. I think it, so you can't go over 500 words. How about that? Because I didn't want to sit here. I mean, I've got 36 of you guys. I didn't want to spend the next 2 weeks of my time at home trying to read these. So, and then as you can see, it reminds me to give y'all a grade system by the 24th of July. So I'm also home and I'm technically off work for 2 weeks. So I'm kind of going to enjoy my time too before I go back to work. That's the reason why I have to set reminders. So 500 words max. Please don't think that you have to do 500 words at all. Just, that's just the max limit. Is that better?
Yes.
Yeah.
Okay. I'm gonna.
So do
hit
we have to put
something
it in a Word document, or how do we type and send it?
I think, hold on. I think when you click on this, I think it just goes and y'all can start typing. That's the way that I understand. If it is not correct, somebody who does this first or whomever chooses to do it, please let me know because I cannot see it. Ms. Roy, I know you listening, so we use you as a lot as a teaching tool. So if you happen to do this first, please let me know. Please send me a message on the side. But if for some reason like y'all started in something like this and it stops you, please send me a message and let me know and I can go back in there and get you in here because I want to know what it looks like. I used to see from the student side. I could see what I needed to see from y'all's standpoint, but they replaced that to where this button right here tells me how long y'all been in here, what you've done in here. I can't see. So I wish I could help y'all out, but I don't know. Did I give y'all any information that y'all would help or anything like that? Any questions, concerns, problems? If y'all will look, TikTok videos acceptable. I am not opposed to taking anything. This is just an open conversation. I want y'all to do some education about EMS. So if anything that y'all will work on and situations that will make you learn something, we'll be interested into it. I will definitely take anything for once. Denise says, did anyone have this issue? Denise, did you order a ebook?
No, I didn't.
Did you order it's from our site? Okay, I tell you what, Denise, if you will email Roy and let him know the issues, and if you just CC me on that email, we can kind of get some things situated. Guys, I don't know if y'all saw this up in the chat. I'm gonna make sure to say this before I close out. Your chat code tonight for attendance and all that stuff is AMJ443. I'm gonna type that again at the bottom. That is your code for the evening. I'm sorry. Oh, I sent that straight to some particular student. I'm sorry. I feel like I shorted y'all this evening, and I am 100% sorry because that is not my pro area, and giving a speech tonight is on medical terminology. I am sorry. If anybody has any questions, please let me know. I'll be on for a few more minutes, and I will be
I have
glad
a
to talk to y'all,
question.
or either we can do a breakout one-on-one. Talk to me. What's up?
My question is about the documents we're supposed to turn in, like what is it? Like the vaccinations, the high school diploma. Who do we send all that stuff to?
Send it to me, baby. I'll take care of it all. You can just send that to me to my email and I will make sure it's taken care of.
Okay, sorry, I thought I was on the mic.
That's all right. I saw your mute button up there. I figured what happened.
Will we be notified, like, if we're missing something, like with the required documents? Because when I originally signed up for the course, I can't remember what all I turned in.
Let me check on that. I will have to ask because there's some inside changes that have gone on. There's going to be some other changes also. So I have not had access to any of that information until here recently because I kind of chose that. I kind of was like, oh, I like being just a teacher. But I will find that out information out and I will let you know because that's important information.
Okay, thank you.
No problem.
All right, man. Are we done for the evening?
Yep, you're done. Again, I apologize to all of y'all that I feel like I shorted y'all, but I promise
no
you this
worries.
is probably the one that I sucked the most in.
No worries. We'll see you in a couple days, brother.
But I definitely will
Be
give
careful.
y'all some more education that we get going. All right, y'all have a good evening and wonderful night and enjoy dinner. I'm glad I got y'all out of here early. So fantastic evening. If y'all need anything, please hit me up on Discord and I will talk to you folks on Thursday. Have a good evening.